Why do melanomas occur? What triggers this cancer that is still considered one of the most serious and potentially deadly? So let's look at the basics of our body. Melanoma originates in melanocytes, which are specialized cells responsible for producing melanin. Melanin is the pigment that gives color to the skin, hair, and eyes. These melanocytes are primarily located in the epidermis, which is the most external, superficial layer of the skin. It is fascinating to understand the progression and metastases of melanoma while looking at the skin layers and making a correlation. But before we get started, welcome back. I'm Dr. Maria Azizian, a board-certified general surgeon and IFM certified functional medicine physician. Please like, subscribe, and share to help our channel grow. So let's continue with skin layers and the correlation with development of melanoma. The top layer of the skin is called epidermis, as we said, and that is where melanocytes reside. Melanocytes are found in the basal layer of the epidermis. That is the deepest part of the epidermis. The layer contains basal cells that continuously divide and push new cells upwards towards the surface. The next layer that is deep to epidermis is called dermis. It contains blood vessels, nerve endings, and other important structures. Melanoma may spread from the epidermis into the dermis, and as it progresses, it gains access to actually lymphatics and blood vessels, and that can facilitate its spread to other parts of the body. And then we have the next layer down that is called subcutaneous tissue. It is located below the dermis and consists of fat and connective tissue. In advanced stages, melanoma can penetrate through dermis into the subcutaneous layer and unfortunately beyond, even through the muscle. That is more advanced and deadly type of melanoma. So now let's look again and more specifically how melanoma develops. So melanoma begins when melanocytes in the epidermis undergo genetic mutations that cause them to multiply uncontrollably. So what are the triggers for that? Excessive UV radiation from the sun, and especially from tanning beds, which cause DNA damage in the melanocytes. So over time, these mutated cells form a malignant tumor. It truly breaks my heart when in this day and age I see patients who are coming in, new patients that are still using tanning beds. Just please don't do it. So how does melanoma grow and develop? The development of melanoma can be classified into phases. So first we have radial growth phase. That means that initially melanoma cells grow horizontally along the epidermis. During this phase, the cancer are still localized and it's actually easier to treat. The next phase is more concerning as it is responsible for spreading of melanoma. It is a vertical growth phase. So what it entails is that as the cancer progresses, melanoma cells begin to invade deeper into the dermis and potentially into the subcutaneous layer. This phase is more dangerous as it opens the possibility for the melanoma to spread, to metastasize to other parts of the body through the lymphatic system or bloodstream. A few words about the causes of melanoma. Just to summarize it, melanocytes are particularly sensitive to UV light because their primary role is to produce melanin, as it is a protective mechanism against UV damage. However, excessive UV exposure overwhelms this defense mechanism, leading to DNA damage in melanocytes. This damage can result in mutations in specific genes. So what happens is that the sunburns, or worse, the tanning bed exposures, cumulatively turn on these potentially cancerous genes that were dormant before. Often, let's say I have a 70-year-old patient who says to me, "Oh, I haven't been to the beach last year and I stayed out of the sun." And that is great. But let's go back in time, and then this patient remembers how they were a lifeguard, or they used to put baby oil to get tanned, and etc. So There's actually a brilliant book that is titled The Body Keeps the Score, and unfortunately it is often but not always true. So the 50 tanning bed sessions 10 years ago, coupled with a few sunburns here and there, may be enough of a trigger to create and cause melanoma for some people, not everybody, thankfully. So what are other more unusual locations on the body where melanoma can occur? While most melanomas originate in the skin, melanocytes are also found in other parts of the body, including eyes. Melanoma that develops in the melanocytes of the eye is called ocular melanoma. Another unusual location are mucous membranes. Mucous membranes where melanoma can arise in mucosal tissues such as the mouth, nasal passages, genitals. The next one, which people are often surprised, are nail beds. Melanoma can appear under the nails and it's called subungual melanoma. So please remove the nail polish when you're coming for a skin check. So just a little message here. So let's look at melanoma subtypes based on the growth and location. Melanoma has several subtypes, and that reflects the origin and behavior of each cancer. So let's start with superficial spreading melanoma. It is the most common type, which grows horizontally across the surface of the skin before invading the deeper layers. Then we have nodular melanoma. It is more aggressive type, and it is characterized by vertical growth, often appearing as a raised bump. The next one is lentigo maligna melanoma. It typically develops in the areas such as face or neck, like sun exposed, and it grows slowly. It is relatively less aggressive form of melanoma, and yet it's still potentially a fatal cancer if not treated in time. Then we have an acral lentiginous melanoma. It is a rare subtype that occurs on the palms, soles, or under the nails, and it is more common in people with darker skin tones. In fact, Bob Marley died of this melanoma on his big toenail at the age of 36. So in conclusion, one of the aspects of the skin that I focus on during the skin check is flat, dark moles, because you can actually diagnose this pre-melanoma in these flat, dark moles. So I spend a lot of time on describing and mapping them. And I understand that my patients sometimes don't share my concern because they don't care about these, what they call freckles, and they care about this skin tags or seborrheic keratosis, which they often call barnacles. Why? Because they're visually uglier. But it's interesting that it's the flat moles that often harbor the atypia, dysplasia, that may lead to melanoma, and that's why I focus so much on them. So please don't ignore any changes in any kinds of moles, both raised and flat. So don't ignore flat moles. So thank you so much for listening. Please like, subscribe, and share. And until next time, bye-bye.